Good evening, everyone. My name is Dr. Timothy Brown, and I am so excited to be here with you this evening. I'm so excited to represent the National Optometric Foundation as the treasurer, and I am so excited to be able to be joined tonight with awesome vision speakers and a special guest with us tonight as we talk about Black History Month and as we talk about the American Heart Month. We want to make sure that we are bringing awareness, making sure that we're educating communities about these things. And we're going to try to keep this going every month so that we're making sure that you are aware of some of the things that could happen with your eye, some of the things that can happen within your body as well. And so the National Optometric Foundation is a nonprofit organization, and we support the National Optometric Association, the NOA, in various ways of community outreach programs and activities in various ways as far as supporting students who are in optometry school through scholarships, supporting students who are thinking about going into optometry school, going into campuses, trying to recruit minorities into the profession of optometry, serving underrepresented communities throughout the US of A. And I am so excited to go ahead and start introducing one of our first vision speakers for tonight, which is Dr. Paula Bone. Dr. Paula Bone was the 2021 Optometrist of the Year for the NOA. Dr. Paula Bone is a board member of the NOF. Dr. Paula Bone is a retired member from the Naval Medical Command, Portsmouth, and as the director of the Norfolk Naval Shipyard Site Conservation Program in Virginia. She is also a past member of the Virginia Board of Optometry. She is also the director of the NOA HBCU Mentorship Program. She is also currently the NOA Regional 1 trustee. Dr. Paula Bone is also a member of the Norfolk Middleton Lions Club in Virginia there. Dr. Paula Bone, welcome to this program with us. We're so glad to have you.
All right. Dr. Brown, thank you for that introduction. I tell you, I was wondering who you were talking about. But I'm delighted to be here to represent the NOF and to further advance our mission and goals and to talk a little bit first about, shall I say, Black history.
Yes, absolutely, Dr. Boone. You just stay on hold for us, and we're going to give you the opportunity to talk with us about Black history because I know you have a lot of great things to share. So, those of you who are listening, get ready, get your favorite drink, get you some popcorn because Dr. Paula Boone is going to be one of the vision speakers that's going to bring us some great information tonight. And now, I'm going to go ahead and introduce our second vision speaker for tonight. This is my lovely wife, Dr. Sharita Brown. She is an optometrist and owner at Insight Family Eye Care. We work together there in Augusta, Georgia, where we are specializing in pediatric eye care and vision therapy. Dr. Brown is the only Black female optometrist with a private practice in Augusta, Georgia. Dr. Brown is also a member of Alpha Kappa Alpha Sorority Incorporated. Dr. Brown is a mother of two, wife to one, and I would love to introduce her to you tonight as one of our awesome vision speakers that will be joining us and delivering some great information to you. Dr. Brown, welcome to the show.
Thank you so much, babe, for having me. Thank you to the NOF for allowing me to come back again and speak about one of my favorite topics, which, if you know me personally, I love sharing about Black history. Black History Month is one of my favorite months. So I am looking forward to doing that also with Dr. Paula Boone and all the other panelists on this evening. Thank you.
Excellent, Dr. Brown. Stay tuned as I introduce our speaker, vision speaker number 3. Dr. Sabrina Reed. Dr. Sabrina Reed is a medical optometrist at Lawndale Christian Health Center in Chicago, Illinois, where she integrates faith and healthcare. She is a fellow in the American Academy of Optometry, a distinction achieved by only 10% of all optometrists. Dr. Reed has recently become certified to do clinical research, and Dr. Reed is a life member of Alpha Kappa Alpha Sorority Incorporated. Dr. Reed, we're so glad to have you on the panel tonight. How are you doing?
Doing great, doing great. Thank you so much for that wonderful introduction, Dr. Brown, and thanks to the NOF for this opportunity. This is my first time on the panel, and just looking forward to a wonderful time of sharing about some very important topics with Black History and American Heart Month.
Absolutely. You stay tuned because I know you got some great things to share with us, and we're excited also to hear from your guest speaker. I'm going to go ahead and introduce her right now as our speaker number 4. So we have Pastor Cynthia Williams in Indiana. Pastor Williams is going to be a guest speaker here with Dr. Reed. We're so excited to have you, Pastor. She's also a realtor. She's also a national spokesperson for the American Heart Association, which is perfect for this month as we talk about the American Heart Month there. How are you doing today, Pastor?
I am fabulous.
Yes, absolutely, absolutely. We look forward to hearing your story. We look forward to hearing any nuggets that you will have to share with our listeners tonight. And we're going to go ahead and open up the show and get started with some questions here, okay? So we're excited, everybody, to talk tonight about American Heart Month. We're also excited to talk about Black History Month. I think it's very important that we talk about these things so that people are aware, because as we know, a lot of people are dying from certain diseases, from many diseases. And one of those diseases that a lot of people are dying from is cardiovascular disease, dealing with the heart disease. One of the things that we try to do as part of the NOA, NOF together, the initiatives is trying to bring awareness about one of the 3 silent killers, which is hypertensive retinopathy. And we're going to have some of the vision speakers to give us some details about this information. So when we start out with our first question, I'm going to start out with Dr. Paula Boone, and we're going to talk about Dr. Paula Boone. Tell us, why is it important that we celebrate this month of February as Black History Month here, recognizing some excellence in Black history?
Dr. Brown, Black history is American history, and it should be celebrated 365 days a year. But I am glad that there is at least a national time to inform and remind this country that Blacks and especially African Americans in the United States have made extraordinary contributions throughout our nation's history. Did you know that many modern conveniences and necessities, as well as life saving devices, are directly related to or a derivative of inventions by African Americans? Part of the Black History Month celebration is to take a look back at some of the significant contributions and inventions that African Americans have made in this country and to the mankind as a whole. Some of these inventions include the traffic light, the refrigerator, air conditioning, the toilet, luggage carrier, lawnmower, egg beater, biscuit cutter, gas mask, fire extinguisher, fountain pen, pencil sharpener, and the disposable syringe. I could go on and on. But in the early 1800s, laws prevented African Americans from participating in legal processes, and many never gained legal rights to their inventions and were not recognized. But there is a list compiled for the record by Henry Baker. He was an African American who worked in the U.S. Patent Office in the late 1800s to the early 1900s. So I would encourage you to Google known African American inventors 1845 to 1980 and consider these people, our people, Black people, who rose from the ashes of slavery to the brilliant creativity of modern day geniuses to make our lives immeasurably better. So Google known African American inventors 1845 to 1980. And this was a list compiled by Mr. Henry Baker. That's just a
Wow.
little bit for now.
Wow, you dropped a lot of great information right there in that little bit of time, Dr. Boone. And folks, just remember, Dr. Boone said to make sure that you Google known African American inventors 1845 to 1980. That's a lot of history, a lot of great information, a lot of things that has been contributed to the American history by Blacks, by people of different color. So we want to make sure that you guys get that information. We also want you to realize that we, as the NOF, we are doing different things to try to educate the communities. And we also want you to know that we now have our Facebook page that we want you to go to and like. It is the National Optometric Foundation. And we also want you to know that we have a website that you can go to find out more about the NOF and our mission and our different activities that we're going to be taking. We are also on YouTube. We have a YouTube channel that we want you guys to go and follow us there. We're going to have videos posted that you can share with your family and friends so that they too can be educated about these things that Americans are dealing with on a daily basis. So let's go ahead with our next question. And thank you all for tuning in tonight. We're going to hear from Dr. Sharita Brown about the hypertensive retinopathy, because this is American Heart Month, and we want to make sure that we hear from each of you about why is it important. Dr. Reed, we can go between you and Dr. Brown. Why is it important that we're celebrating American Heart Month?
Well, I will say, as part of the NOF and the NOA, the NOA highlights the 3 silent killers, and one of those 3 silent killers is high blood pressure. And as you know, that is something that is very high in the African American community. So we do need to know our numbers in regards to that as well. And then hypertensive retinopathy, it can affect the back part of your eye and cause issues and blindness. So as an initiative with the NOA, we have to make sure that we advocate for the African American communities to get their eyes checked for these reasons. I'm sure you know someone in your family who has high blood pressure if you yourself does not have high blood pressure. And people sometimes don't realize that this can also affect their eyes and affect their vision. So getting them in with an eye exam, and sometimes an eye exam can even be some of the first signs to detect that you do have high blood pressure. So getting in and getting your eyes examined, getting your eyes checked is very, very important to make sure that you are not at risk for high blood pressure. Also making sure you don't develop hypertensive retinopathy if you do in fact are diagnosed with high blood pressure. So it is very important, and it's one of the initiatives that the NOA has and that the NOF is also in support of.
Very good. Absolutely. You're absolutely right. We want to make sure that we're monitoring those numbers. It's very important to make sure that you know your numbers, making sure that your blood pressure is under control, making sure that you are aware of your family history as well. Come on, Dr. Reed, tell us what you are feeling today as we're talking about why is it important that we talk about and raise awareness about American Heart Month.
Well, it's important to be aware of American Heart Month because heart disease is the leading cause of death in the country. And that disproportionately affects African Americans. And raising awareness ultimately, we hope will lead to people living longer and more healthy lives.
Very good. Yes, very good. We want to make sure that we reduce risk, make sure we reduce death, and we're trying to do our part in educating the community. Thank you, Dr. Reed, for that input. And we're going to go ahead and go on to Pastor Williams. Why do you feel this important? What do you have to say about American Heart Month as you are the spokesperson for the American Heart Association?
Well, first of all, I want to say thank you all for allowing me to have this opportunity to do this. One of the things that I feel that our community is not aware of is that Heart failure, heart disease is the number one silent killer of our people, especially women, because we are the carrier of stress. We are the basically we're the foundation of our family. And a lot of times we're so busy caring for others and their needs and what's good for them and medicating them that we ourselves go in lack. We forget about to care for our hearts. We forget about taking time for ourselves, education, exercise, meditation. And a lot of times, not to knock breast cancer, because I do know breast cancer survivors, but the number one killer of women, men, is heart attack, heart cardiac arrest, those things. And we're not aware that with Big Mama's food, with all the grease and all the good things that we eat, we have to do something to offset our genetic history. Who doesn't love a ham hock and turkey? Who doesn't love fried chicken, pork chops? And it's okay. But the thing about it is, we have to understand there is a balance. There are things that we need to do to make our heart healthy, not just our natural heart, but our physical heart, our mental heart. Because sometimes you can have a broken heart naturally and emotionally, and that is a killer as well.
Wow, wow, wow. Thank you so much there. You are absolutely on point with that. So we want to make sure that we're taking these things in. And as Dr. Reynolds said, we want you to realize that Blacks, African Americans, they have high blood pressure early on. It's a part
Mhm.
of family history some of the times there. And we need to make sure that we're getting these things checked early because things are complicated when we get too far along into the different stages of hypertension there as well. And so let's talk about, Dr. Bone, what are some of the signs and symptoms of cardiovascular disease or hypertensive retinopathy, and some of the other panel members can fill in as well?
Some of the symptoms for women are usually different. And usually you think you're going to have chest pains, you think you're going to have other issues that would signal that you're actually having a heart attack. But sometimes it is silent. You may have digestive symptoms, headache, um, things that would not necessarily trigger or suggest that you're having a heart attack. You know, some pain in the arm. Um, Other symptoms are different. Fatigue, you know, that seems to be unusual. So we need to look at many of those symptoms and not just think you're having a heart attack because you're having chest pains. Some of the symptoms are silent. Some of the symptoms are a little less suggestive of what we used to think of one having a heart attack, and particularly in African American women.
Absolutely. And I mentioned hypertensive retinopathy, but we, just as you were saying, it's one of the silent killers of your vision. You can have vision loss and not really have a symptom from some of these things there. So, one of the best things that you can do is get checked. Go and schedule your eye exam today. Don't delay. Call your local optometrist and make sure that you are on the schedule for 2022 for your eye exam. Make sure you call your primary care provider and get on their schedule for 2022 for your heart health check. Make sure that we don't delay these things and put it off to the side. Encourage your family members to get checked. Talk about your family history so that you know what is going on in your family. Anyone else from the panel would like to speak on cardiovascular disease, hypertensive retinopathy?
Well, I just want to also add that we saw in the chat box with Dr. Reynolds that the risk factors, the main one is high blood pressure, which Dr. Brown had mentioned. And one in every three African American adults has high blood pressure. And it does start earlier. And for the most part, we're usually not under control. We're not taking medication. We're not following the guidelines of our physician. As Dr. Brown has said, we're also having visual difficulties as well. So along with the high blood pressure, the obesity. 69% of African American men are obese, 82% women are obese. The high cholesterol, which leads to your blocked arteries, and of course, that leads to diabetes. And also cigarette smoking. That doesn't seem to be too much of a problem these days in the African American community. but it is a risk. So if you are having any of these other symptoms or health systemic ailments, you're looking for a heart attack or stroke.
Right. And Dr. Reynolds also pointed out that one of the key things about hypertension, your blood pressure may be high, is headaches. So make sure you don't ignore headaches. You know, headaches and cardiovascular disease can lead to so many other problems within the body there. It can cause problems within other organs throughout the body. So don't keep putting these things off. Get checked, find out about your family history, make sure that you are taking care of yourself there. So let's continue the discussion as we're going here. Let's just point out some of these stats here because we are raising awareness because guess what? People are dying. They
Mhm.
are dying from some of the things that we are bringing to your attention. And we want to try to reduce this from happening. One person dies every 36 seconds in the US of A from cardiovascular disease. 659,000 people in the United States die from heart disease each year. That's one in every four deaths that's happening. And as Dr. Boone said, heart disease is the leading cause of death for men and women in the United States there. So we need to make sure that we raise this awareness, make sure that we're talking about this, make sure that we are doing something about this because not only are people dying, but we're spending so much money in the United States towards this each year. Over $363 billion was spent between one year, 2016 to 2017, that one year, $363 billion there. So let's make sure that we continue this talk so that we can raise awareness and make sure that we can reduce the number of people that's having death, the number of people that's becoming disabled because they're losing their sight due to hypertensive retinopathy. Dr. Reed, I think you have something to tell us about what can people do to lower their risk of these things here? What can they do? What's some tips that they can do to lower the risk of cardiovascular disease,
So
if
glad
you
you
will?
asked. To lower our risk of cardiovascular disease, there are some basic things that we can all do. One is reduce your sodium intake. Everyone wants to enjoy their food, enjoy their meals, but the sodium is one of the biggest things. So it's important to read labels and experiment with other flavor profiles that are not sodium centered as far as your cooking and your meal preparation. Of course, it's been mentioned a moment ago about obesity and your ideal weight, knowing what your ideal weight is, and just get moving in order to help achieve and maintain your ideal weight along with your healthy eating, not living a sedentary lifestyle. A lot of us spend a lot of time on our devices and indoors, but just getting outside, getting some fresh air, and getting moving, whether it's indoors or outdoors. We talked about stress. We talked about not smoking and regular checkups, but a couple things maybe that we didn't hit on. One is getting your proper rest. How many of us are guilty of that? Not getting enough sleep at night. Your body needs rest. And so that can contribute to cardiovascular disease, and diabetes is a risk factor as well. And so it's important to monitor your blood sugar and make sure that that's under control. So, and part of the smoking, blood sugar, healthy eating is also limiting your alcohol intake. So, the things
Absolutely.
that are good for your heart health, those are ways you can lower your risk factor for many other conditions and comorbidities.
Yes, absolutely. Very good points there that you bring to our listeners tonight, Dr. Reed, there. And thank you for giving those tips to them so that they can help adjust their diet, their intake of sodium. You know, it's a lot of things that we're taking into the body that has sodium in it. And we just need to read and learn about what we are taking into the body there so that we are not increasing that sodium intake to the point where it's causing our blood pressure to rise and leading to coronary artery disease, heart disease, things of that sort, putting more stress and strain on the heart there. So thank you for sharing that with us there. Now, I'm going to switch over so that we can celebrate Black excellence. This is Black History Month, and we know Dr. Boone already gave us the intro that we've had things that Blacks have contributed to our history. They're contributed to the American history, and we're so very thankful. And tonight, I have Dr. Brown and I have Dr. Boone highlighting some of the things in optometry that Blacks have contributed, and also highlighting some of the things in the heart health profession as well that Blacks have contributed. And we are excited to hear about these things. So I want you guys, you can get a pen, jot down some names so that you can go back and get additional information as they speak upon these things here. And I'll let Dr. Boone and Dr. Brown go ahead and let's introduce the listeners tonight about Black history as it relates to optometry and as it relates to the healthcare field.
Okay. If Dr. Boone doesn't mind, I'll go ahead and share a few things. Of course, we are the NOF. We are part of the National Optometric Association. So I would be remiss if I did not mention the founders of this great organization, Dr. Powell and Dr. Howlett, who helped establish this. And the mission has always been the same. It's the recruitment of minority optometrists. And that is why all of us are before you today to kind of carry on that mission. And we are so thankful to them too, because we definitely need to continue this in our profession and build up our profession as well. I would also be remiss in not mentioning Dr. Paula Boone, who is the first, the first licensed African-American female optometrist to practice in the state of Virginia. Now, a couple of other people that I'm going to mention is Dr. Ollie Powell. He was the first African-American to have a private practice in Alabama in 1977. That is an accomplishment in and of itself, just to have a private practice, but also in, the deep South as well. So I can only imagine some of the obstacles that he faced just achieving that particular feat. We have Dr. Betty Harville. She was the first female optometry professor at the Southern College of Optometry, and which also made her the first African-American professor, a female professor in the United States. We have Dr. Melvin Shipp, who was the first African-American elected president of the Association of Schools of College and Colleges of Optometry. And he was also the first African-American to serve as the president of the National Board of Examiners in Optometry. And someone else I'm going to mention is Dr. Linda Johnson. She was the first African-American optometrist in Mississippi. And this is just a small reflection of the many great African-American optometrists who practice in our field. If you are an African-American optometrist, you are Black history, and you should celebrate yourself and celebrate your accomplishments that you were able to achieve in this field, because other people need to see us and see us representing. I know in my practice, I see a lot of children, but I make it a point to always try to speak life and speak encouragement into those kids, because I know just seeing me practicing is something that will help shine a light into their lives. But also I want to encourage them that they can be whatever they want them to be. So I know this month I have been reaching out to various optometrists, and many people have given me feedback, and I've been able to highlight some people, and some people don't feel like they accomplished enough to be recognized for Black history. But just you being you in and of yourself, being able to show up fully in practice fully, you are a representation of Black history, and a proud representation of Black History Month. Now, I also want to mention, and then I'm going to let Dr. Boone take over, is Dr. Patricia Bath, who recently passed away. She was an ophthalmologist. Now, she is well known for her contributions with the laser phaco device for cataract laser surgery and everything. But what she was also known for is that she gave back to so many African American communities. That was her mission. She looked at the disparities of eye care and vision care in African American populations, and that was why she did some of the things that she did. And I feel like she is totally in line of some of the missions and the objectives of the NOA and the National Optometric Association. And she was also a founder of the American Institute for the Prevention of Blindness, which helps give those in various countries that don't have access to eye care, as well as giving children the gift of sight through her foundation's contributions in eye care. And like I said, that is just a tip of the iceberg of all the many optometrists in this great profession, Black optometrists in this profession. All right. I'm sorry, Dr. Boone. I'm going to let you finish up.
That's all right. There's so much to go around. There's so much information. There's so many personalities we need to recognize. I just want to add also that Dr. Ollie Poe was the president of the Alabama Board of Optometry. That was something too.
Yes.
Actually be voted as president of the Board of Optometry, and he was one of our past presidents of the NOA. He also was able to establish relationships, one of the first relationships with Modern Optical, and that was at least 20 plus years ago, and we still maintain that relationship because of his affinity and relationship with Modern Optical, and there's a scholarship in his name. You also talked about Dr. Havel, which was wonderful. She was the first, like you said, the first full professor. And Dr. Shipp, I wanted to add, also, he was the first dean, Black dean of a U.S. College of Optometry. And that was, of course, at Ohio State. I wanted to add that the NOA has 3 OD awards, and those awards included Dr. Harvell, Dr. Mel Shipp, and Dr. Edwin Marshall. It was under the leadership of Dr. Cheryl Reynolds as the NOA president in 2021 that these scholarships were, awards were established for young ODs. And Dr. Reynolds is the associate professor at Nova School of Optometry in Florida, and she is the chief of advanced ophthalmic care and specialty testing. And under her leadership, the NOA gave away $85,000 plus. And I believe that is a record high of scholarships in 1 year given. Also in that 3 Young OD Award was Dr. Edwin Marshall, who was the first Black tenured professor of optometry in the United States, and that was at Indiana University. He was also chair of the executive board of the American Public Health Association, past president of the NOA, and it was during his leadership that the organization addressed health-related initiatives at the national level. And it was also during his tenure that the National Optometric Student Association was established. Both he and Dr. Shipp were inducted into the National Optometry Hall of Fame, with Dr. Shipp also being the first president of the first optometrist, not only the first Black, but the first optometrist to be president of the American Public Health Association. So our founders, Dr. Howlett and Dr. Powell, along with Dr. Shipp and Dr. Marshall, have been enshrined into the National Optometric Hall of Fame. I'm so glad you talked about Dr. Bath, and she unfortunately has passed, but she's left a wonderful legacy. And coming behind her is Dr. Constance Okeke. She is an expert cataract surgeon and a leader in microinvasion glaucoma surgery. She was the first in Hampton Roads area, which is where I live, to offer the eye stent, and the first in the country to combine trabecular glaucoma surgery with the femtosecond laser in cataract surgery. Dr. Okeke also has an educational YouTube channel featuring glaucoma surgical techniques and eye glaucoma for health professionals. And she also has a YouTube channel, Eye Glaucoma Patient, for patient education and support. So as far as optometry, that's just a few of noted trailblazers. There's so many more. And as far as heart health, I was astounded to find, and I always thought of heart health and Dr. Daniel Hell Williams. If you Google him, it says he was one of the first to perform a successful surgery, open heart surgery, back in 1893. But the truth is, he was the first man, period, not just black, but the first physician in the United States to successfully perform open heart surgery. No one else before him. I was also delighted to find that the first woman, not just black, but the first woman in the world to perform a successful open heart surgery in 1943 was Dr. Myra Logan, an African American who went to an HBCU. She started at Clark Atlanta University, and that was back in 1943. And another tidbit of history, Otis Borkins, he was an engineer. Did you know he was famous because he developed the control unit for the pacemaker, which uses electrical impulses to maintain a regular heartbeat. He too was an HBCU graduate of Fisk University. So all right, HBCU, all right, African Americans, we have contributed so much, and I am grateful that we are having this time to talk about them. So don't let us be just per month. Find out every month. There are enough contributions and inventions that we have established that you can find a new one every day. 365.
Yes, that is so true. And I want to mention too how you shouted out the HBCUs. Also, the fact that they went on and accomplished all of those different achievements and stuff. It
Mhm.
also goes to the fact that oftentimes they were not even allowed in the medical colleges and universities. So the only way they could get that knowledge was going to HBCUs or having to go out of the country, like to Canada. So for them to
Mhm.
all the obstacles that they face just to become doctors and physicians and then to go on and achieve the greatness. We come from a very rich history of people,
Indeed.
and we should be very, very proud and not take anything for granted. And even with the NOA and the NOF, I hope y'all are liking and sharing and donating to the NOA and the NOF as well, so that we can continue on, because these types of organizations are very necessary and very needed in our community, so other people can see what it looks like, and so we can also give the support to people who look like us, who might be facing different obstacles and challenges in their day-to-day optometric careers, because we have come a very long way, but there is still many roads and many things that we still need to achieve thus far. So
Absolutely, absolutely. Black representation is critical to our survival,
yes.
to our sight, to our survival, to our
Yes.
lives, to our living. We need more representations of African Americans and minorities in the healthcare field because it is critical to our survival.
Absolutely. And thank you, Dr. Boone. Thank you, Dr. Brown, for sharing great information about those who have advanced the African American history, Black history in the field of optometry, in the healthcare field. We're so delighted that you guys could share that information with the listeners tonight there. And we want you guys to know that February is a great month to pause and recognize Black excellence, but don't let it stop there. All throughout the year, we celebrate American history, Black history, all throughout the year. I have one more doctor that I would like to hear from tonight as she share a few minutes about Black history, and that's Dr. Reed. If we could bring on Dr. Sabrina Reed, and she'll have a little bit of information to add on to what Dr. Boone and Dr. Brown has already shared with us in regards to Black history.
Thanks, Dr. Brown. I would be remiss if I did not mention one of our NOA trailblazers who was very instrumental in my life and my career choice, my mentor, Dr. Charles Comer. was one of the first two African Americans to graduate from the Indiana University School of Optometry back in the 1960s. He served as the NOA president and also was the meeting planner for many, many years, and was just a part of the legacy and a part of basically whose shoulders, the doctors whose shoulders we all stand on, and who passed the torch to us. And we carry it proudly. And I just wanted to give props to him as well as being one of the great doctors and the collaborators with the founders of our great professional organization.
Thank you. Thank you. Thank you. Thank you, Dr. Reed, for sharing that great information there. You know, trailblazers there in the Black history journey there. Thank you for sharing that. And one day, someone's going to also mention your name as a trailblazer as well. So keep up the great work that you're doing. And I am going to also ask that you do me a favor. Go ahead and introduce your guest speaker with us and let us know a little bit about her. And we want to hear from Pastor Williams. Pastor Williams, I heard, has a story to share as we switch over to talk about American Heart Month again there. So I want to hear from Pastor Williams there as you introduce us to her again.
Wonderful. I'm so delighted. Pastor Williams was able to share with my sorority chapter. We have a national target that we promote for the Pink Goes Red. It's for American Heart Month. We have a special impact day where we attempt to raise awareness as well for women and how we're affected by cardiovascular disease. And Pastor Cynthia Williams was our speaker. And I said, oh boy, this is a can't miss story of survival. It's very compelling. And I'm not going to, I'll let her tell her story. But we talk about how the eyes can be the window to the soul. A lot of times people don't know the eyes can also be the window to the heart and what's going on in your cardiovascular system, because our eyes, believe it or not, is the only place that we can actually see the blood vessels without doing an invasive procedure. So if there's a blockage in a small blood vessel in the eyes, sometimes we know that may have come from a major artery, whether it's in your heart or going to your brain. And we get indicators for things like stroke and cardiovascular disease, elevated cholesterol. So as we talk about the eyes, we want to be very mindful of how that can affect your heart. And with that, I would turn it over to Pastor Cynthia.
Hello, 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 and thank you so much for this opportunity. I want to do a hashtag for all of my eye doctors and say Black Eyes Matter as well. But that is not my story today. I want to talk about heart health and how I should have been dead. This is my week, my anniversary week of my funeral. I want to introduce you all to my menopause child, Kennedy. Say hello to the world, Kennedy. Hi. This is what happens also when you have a child over menopause age. So let me tell you about my cardiac story. I was about 41 when I found out that I was pregnant after a tubal ligation. So I had my tubes tied and found out that I was pregnant with my menopause child, Kennedy. Well, after going through an easy pregnancy, about 2 weeks later, on February the 15th, actually, I started having problems breathing, and my blood pressure was elevated. I was taking my own pressure. And in our community, it is common for us as Black women, as Black people, to self-medicate. So as my pressure was going up, I just took a double blood pressure pill, and it just kept going higher and higher. And then all of a sudden, I was having problems breathing. And Kennedy at that time was about a week and a half. So at my 2-week checkup with the doctor, I kept on saying I can't breathe. I was having problems breathing, and I had swelled up so bad. I wound up going to the doctor, and my pressure when they did my, when they first go in, it was 180 over 104. So I was going in congestive heart failure, and it kept taking my pressure, and all of a sudden I felt a pop. A lot of times people think a heart attack is going to be like Fred Sanford and Weezy, here I come. It doesn't happen like that. That is TV. In reality, you can be walking, have jaw pain, to have a cardiac event. Your left side starts to hurt. But because we do not pay attention to the signs of our bodies, we just keep going and going and going and going. I have a saying said, your body will talk to you when other things won't listen. So even when you should rest, even when you are tired, but yet you keep going. Nevertheless, I went into the hospital, and not only did I have congested heart failure, my lungs collapsed because I had started retaining so much water that it began to squeeze my lungs down further and further. So they had a choice between my heart and my lungs. Either way, I was in critical condition on both. Heart conditions can happen to a lot of us when we don't know the signs. We don't know how not to be stressed. We don't understand that it's okay to say no. It's okay to release. It's okay to be okay with saying no and doing nothing. In my journey with having a child at 40 plus years old, we have a 34-year old, we have a 31-year old, we have a 26-year old, and a 12-year old. So a lot of times people think my menopause baby is my grandchild, and I said no, she's me. Also, I want to talk to about when the doctor talked about salt and the salt intake that we use. My daughter, the 12-year-old menopause one, she was cooking some eggs, and all of a sudden she just putting salt on the eggs without tasting it. And I looked and I thought about how historically and genetically, when we cook our food, we just put salt in it without even knowing if it needs salt. So that's another thing that we need to stop. Also with exercise. Now, going with a BMI, a lot of times the numbers are high, but I am a person, if I'm healthy, if I'm heart healthy, if my pressure is okay. I may be a little over 100 pounds or 120 or 140, but the numbers really are not the factor. It's the heart. It's your health. It's a lot of things contributing, your stress level. When I go and I exercise, that's one of the things I do. First thing in the morning, I wake up, I pray, I meditate, and I go do yoga. When I'm in yoga, I am the only one that look like me in yoga. When I go swimming, I am the only one that looks like me in swimming because they say black people don't swim. But we do swim. And we are historically known to eat our lives away, to damage our own hearts. But when I look back and I think about educating everybody, how important it is to live life, to have a healthy heart, to just be happy. Because not only is your natural heart suffering, your spiritual heart suffers as well when we are depressed, when we are dysfunctional, when we're not happy, when every day is always something depressing. So not only do we need to take care of the natural heart, we need to take care of the emotional heart, the spiritual heart, and just be happy with who you are. I am so thankful for this menopause baby that I have, that God has afforded me to have, to talk to the doctors. Historically, I have a job. Not only am I a pastor, I sell real estate. And knock, 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 just to send a shout out, I just was awarded the National Honor Society by Berkshire Hathaway, which is Warren Buffett's company, for being the top 12% of the nation in realtor. It's stressful to represent so many people that look like us who don't even have a chance. So in order for me to keep my heart healthy, I have to do the things that make it happy. I take care of my mom as well, who's at end stage dementia. I love my geriatrics. She just got married 3 years ago, so I take care of her husband too. So when people look at me, it's like, wow, you got so many things on your plate. How do you handle it? I said, because I have a happy heart. My heart is happy, and that is the muscle that I keep strong. My heart's happy, my mind's happy, and I exercise. I'm excited about every single day that I have a beating heart. So, to our people, I encourage us not to just be at the salons for 2 and 3 hours getting our hair done, getting our nails done. When I go there, I see plenty of us. But when I go swimming, when I go to yoga, when I go on nature walks, when I go by myself, just to enjoy the things that don't really cost me a lot, my heart tells me it's okay. Every time that heart beats, you ought to be excited about what you can do, because each and every day your heart beats. Know that somebody's heart has stopped, whether it stopped naturally or they become a walking corpse. Know that every single day that your heart beats is a good day for you. That's my spiel. I want you all to say hello to Kennedy, who's going to be a doctor too. And she is a living example of what a heart healthy mom can do. She should have not known her mother. I should have been dead. This is my anniversary. So it's always very, 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 very special to me when I get an opportunity. Because when I look back 12 years ago, they were saying that I was not going to make it. They were saying that I would never be the same. Well, out of the things that they said, one thing is for sure: I am not the same. I am better than I was because I got a better heart. And it didn't require a transplant, it required a mind transplant. So I changed my thinking, which also changed my heart.
Thank you so much, Pastor Cynthia. What did I tell
Yes.
you, folks? It's a survival story that you don't want to miss. We appreciate you so much. Thank you.
Mm. Thank you all. You all being blessed.
Wow, what an incredible testimony. I
Yes,
felt like
yes.
passing my microphone over to Pastor Williams because she just preached our souls right there, man.
No.
That was
Yes,
incredible.
yes.
Oh,
Amen.
that was
Amen.
amazing. As you share about being happy and having less stress in your life and having a happy
Mhm.
heart and making sure that your natural heart, is not affecting your spiritual heart. Those are great things that you just share with the listeners, and I know that somebody out there was touched by the words that you shared. And for you to be
Mhm.
there, continuing
Yeah.
your journey, doing all of the things, moving your feet, swimming, going to yoga,
Mhm.
I mean,
Mhm.
you are a living testimony. That's incredible. That's
Amen.
incredible. You just gave me goosebumps. That's good. That's good right there. So
So
I
you
am
all should do that hashtag Black Eyes Matter as well. Because a
yes.
lot of times
Mhm.
people don't realize that they do. I just went and got my annual checkup, and they checked the pressure in my eyes, just stuff that I wasn't even aware of that even was connected to my heart. It's just like the information. Black lives matter, black money matter, black eyes matter. Everything black matters.
That's right.
Mhm.
Thank you so much. Hashtag Black Eyes Matter. Your heart matters, your health
Mhm.
matters, and your black eyes matters. So I appreciate it. Thank you. Thank you for sharing that with us. I appreciate that so much.
Amen.
And I want to also encourage people to like our National Optometric Foundation page. I also want to encourage you to visit our National Optometric Foundation website as well. We do accept donations. We are a nonprofit organization. The things that we do, the support that we give to current optometrists, to students interested into the field of optometry, to HBCUs, to communities when we do free eye exams, free glasses. We've given away thousands of eye exams and glasses to
Mhm.
communities all around the United States of America as we continue to support the mission of the NOA as well there too. So please, if you can, give us a donation. Click on our page. There is a button there for you to give donation. If you go to the National Optometric Foundation and you go under the tab for About, there will be a button down there for you to donate to our foundation. We would greatly appreciate it. So if you would, somebody may not have had the chance to be on live, but if you would just like this event and share it to your personal page so that your followers can also have a little bit of this education that was given out tonight, I would greatly appreciate that as well there too. We are on YouTube, so please make sure that you follow our YouTube page and make sure that you visit our National Optometric Foundation page there as well to find out more about our organization. We are accepting new members. If you are interested in being a part of the NOF family, the NOA family, we encourage you to do so because we would love to have you as a part of our family there. So as we wrap up things tonight, I know a lot of you were expecting, I'm here live on Jason T. Mahoney, the Motivators page, and you were expecting him and you got Mr. Positivity instead. Jason is behind the scenes helping our organization be the best that it can be there. So we want to give a shout out to Jason T. Mahoney for helping us out, for being the guy behind the scenes that's making this show possible today. So thank you, Jason. I also want to say thank you to our fabulous speakers tonight. Wow, you guys really did an excellent job there. Dr. Boone, thank you so much for sharing. Dr. Brown, thank you so much for sharing. Dr. Reed, thank you so much for sharing. Pastor Williams, thank you so much for preaching to us tonight. We love you. We appreciate it so much there. So as we're wrapping it up there, because we're getting on the hour stretch here, I want to encourage you guys as panelists to leave a word of encouragement. This word of encouragement can be about optometry. It can be about life. It can be about the heart. Just leave a word of encouragement as we're wrapping up this show tonight there. For me, Mr. Positivity, I want to encourage you to, as part of having less stress in your life, change your mindset. Have a positive mindset. You know, we're going to go through challenges in life. We're going to go through some struggles and some setbacks, but don't let those things stop you, weigh you down to the point where you can't bounce back. I want to encourage you to bounce back. Don't let things hold you down. And remember that challenges that we face, they're there to make us stronger. They're not there to tear us down and to keep us down, but to make us stronger. So I want to encourage you all to bounce back. Go ahead, panelists, leave a word of encouragement.
My word of encouragement will be in regards to our healthy diet. I always advocate for nutrition and healthy eating. And as we try to lower our sodium and decrease our intake of processed foods, increase our fruits and vegetables, everybody knows that carrots are good for your eyes. But a fun fact, nutritional fact about eye health and nutrition is the fact that dark green leafy vegetables, your kale, collard greens, spinach, those dark green leafy vegetables are very, very rich in nutrients that benefit your eyes and your eye health. So all of the colored vegetables are great for your eyes, but if you could load up on that kale, the research has shown that it's off the chart as far as the benefits for your eye health. So that's my fun fact and tip for today. I want to leave you guys with that encouragement.
I'm going to say a quote from Dr. Martin Luther King, and I'm going to read this to us. It says, "One day we will learn that the heart can never be totally right if the head is totally wrong. Only through bringing together of head and heart intelligence and goodness shall man rise to fulfillment of the true nature." Everybody, love your heart. Pastor Steve.
Wow. Incredible. Thank you.
Okay, I guess I will go ahead and share my tip. I want to say thank you, though, to the NOA, the NOF, as well as to all the wonderful panelists that I shared the floor with on today. I will say in regards to heart health, as was mentioned previously, make sure you eat a lot of healthy and green leafy vegetables, but also be mindful of your sodium intake. Sometimes we think of sodium as how much salt we're sprinkling on our food and things of that nature, but there are other things that are very high in sodium. Sometimes when you think you're eating a healthy salad, look at the salad dressing. A lot of those things are high in preservatives that do have salt. So anything that's in your pantry, frozen foods, those kinds of things, make sure, look at the label so that you'll know your salt intake with that, because you might be surprised about how much salt is actually being included in your diet and things that you don't automatically think about. Also, in regards to Black History Month, my favorite month, I just want to share that if you, as I mentioned before, if you are a Black optometrist, you are Black history, you are your ancestors' wildest dreams, show up as your full and authentic self, because you never know who you are inspiring. You never know who you are encouraging. So be true to yourself, be true to you, and know that you are making an impact, and know that you are making a difference in the world just by showing up and being and representing yourself as a Black optometrist. Okay, that's all I had to share.
All right.
Absolutely.
All
Thank
right. Mine too is in reference to Black history. I want to encourage you to do more research, know our history, know our heritage, know the contributions that we've given, and pass that on to your children, to your grandchildren. Let them know that they are Black, they're beautiful, and they are brilliant, and they come from people who are the same. So just think, uh, consider that we have endured and accomplished so much in over 400 years with God's help, starting from an American foundation of slavery and servitude to performing the first successful open heart surgery in the world. So know your history, be proud of it, pass it along, and let's keep this information going 365. For any students who are interested in optometry, I'm the director of the HBCU mentorship program. Call me. We have funding for you. We have support for you. Pastor, is your daughter interested in optometry? Have her call me. We'll start her at high school
Wow.
and get her through to practice.
Wow.
Absolutely. Thank you. Thank you so much, guys. I really appreciate it. We're going to go ahead and wrap up this evening. We have had a power hour. This has been an impactful moment, full of great information about Black history, Black excellence in the field of optometry in the healthcare field. This has been an impactful moment for discussing the American Heart Association risk factors for cardiovascular disease and also hypertensive retinopathy, one of the three silent killers that we help promote as along with the National Optometric Association. Here, the NOA, the NOF, we really thank you. In the NOSA, our National Optometric Student Association, we appreciate you all. And we hope that you will go to our website, the National Optometric Association.com/foundation. Check us out, learn more about us, become a part of us, donate to help us continue to do the great things that we do in various communities throughout the USA. Also, as we're giving scholarships to students who are currently in optometry school, students who are trying to go to our national conferences, students who are thinking about going into optometry school, they're going into different HBCUs, recruiting students to the field of optometry. That's what we do. And we want to continue to help save eyeballs one eye at a time. I hope you guys have a great evening, and we look forward to talking with you next month on our next topic. So stay tuned and make sure you stay alert on our Facebook page. Have a great night.